at 8 o'clock Eastern Standard Time. Yep, and I am trying something new, trying to reach my audience and kind of give more information about healthcare. So I'm gonna wait just a second or two. Come on in if you're on Instagram, which I am trying Instagram at the same time, and I'm doing Facebook as well. Um, just to get people on, it would be great to have you come on. If you have questions, I can take questions on Instagram. Yep, yep. Just to give you a little insight, some of you probably are like, who is she? Well, I am Jewel White Williams. Okay. And I have a doctorate in health sciences, and um, it's in clinician as well as higher education. I am a former principal and former teacher. And at one point, I worked in the lab. Yep, in a lab for quite some time. And one of my key things that I enjoy is teaching, and I love science. So I just wanted to just make sure I could blend the both, and that's exactly what I am doing now as a doctor of health sciences. I currently am working as an emergency medical technician, and a host of other things. I focus on community health collectively, and that's one of the, I just enjoy it. I really do. Today, one of the things that, and I stated, let me explain something. I stated last Thursday that I would go live. And I said, I may try it off and on so that I can have people learn more about who I am and what I do. I don't consider, I know a lot of people say they're experts at what they do. Um, I am knowledgeable about the things, about several things, but because I took my strengths 2.0, I'm just going to be really honest with you. I love to learn, and I like to learn more about things. Research, it's one of my passions. I love research. PubMed, Google Scholar, you name it. I can go on. Ovid. And I enjoy researching. And the reason I like researching is because it allows me to gain more information about various tools and how I can help various communities. Um, and so I was going to tell you what it would be great is if you have questions about health. I am not a physician. I like to make sure that you know that. I am more than willing to discuss how you can communicate in a more distinct way, in a distinct fashion, with your healthcare provider. And that comes from being a caregiver of 7 people. Yes, you heard that right. So, as I'm doing this live, I do want to let you know that I have Black Tie Legacy. That is the umbrella of everything that I do. And I also host Cold Press Conversations. It is a platform where I amplify the voices of medical and health science professionals, and it gives them an opportunity to tell us and teach us and help us learn more about healthcare, about the medicine, about clinical trials, about EMS services, about community platforms. It gives us an opportunity to learn more about our communities. I could give you a whole spiel about community health, because I've learned a lot, and I even took some courses and got a certificate on it, about community health and how community health is important, and how you can learn more about your community health. So I'm just gonna today. I thought I just go on and discuss, and just have a conversation. And if you have questions, like I said, I can take them on Instagram. Let's talk about emotional intelligence as a patient. I want to talk about emotional intelligence as a patient. Um, First, I want to discuss emotional intelligence from a whole different platform. Emotional intelligence, and one thing I want to do is the ability to manage your emotions, understand the emotions of other people. That's what emotional intelligence is. Understanding the emotions of other people and able to manage your own emotions. And if we take that in consideration when we talk about emotional intelligence, that's where we need to understand that our emotions influence how others may react to us. And that's one of the key things that I want to discuss. How, when we go into a doctor's office, we may not be feeling well, but also how we communicate with the physician is one way that we need to think about how they may respond to who we are as well. It's kind of a give and take kind of thing. And I just wanted to kind of talk about that just a little bit. As a patient, you can have a lot of emotional intelligence. You come in and you have a lot of intelligence. You have a lot of emotions, but are you regulating them appropriately? And that's one of the things that we have to think about. How are we advocating for our health care with our emotions? And if we consider that, that will help us understand how we can learn more about ourselves. And so it's kind of like a give and take process. We talk about putting your hand in the lion's mouth. You want to be real careful because they're the ones who have the knowledge base to help care for you. And yes, there are some people that you feel may be better than others. It's okay. Sometimes you just have a better connection with that particular physician. Understood. That's even with friendships. But one of the things what one item I would like to share with you is that building a better relationship with your healthcare professional helps a lot. Using terms such as I have a concern about, I am anxious about. When you use appropriate words, it allows you to be heard. They only have like 7 to 10 minutes to talk to you. So you need to kind of have your stuff in order ahead of time. So communicating your needs clearly and regulating your emotions in that process is one of the key things that I think is important. It's one item that is very important. So that's what I wanted you to get under your belt. How to communicate clearly and how to communicate clearly your needs. And if you come in prepared and have something written out, or at least a couple questions, you only have 7 to 10 minutes, at least it allows you to feel well prepared. And they can attend to whatever your concern is because you have it written out. You know exactly what you're going in, as opposed to saying, I just don't do this. And I don't, you want to have something in hand and be slightly prepared with it. Now, providers, I know we talk about providers, talking about your physician. They are people too. I'm going to put that again. Your physician, your dentist, your any other specialist, they are humans. They have emotions as well. And so if they're having a really rough day, it's not done intentionally. Some things happen. But you want to keep that in mind, that you just want to work with them through that process and show empathy for them as well. And just say, thank you so much for taking this time to explain this to me. Like, if you show your kindness, normally it comes right back to you. And you can also be a little honest, but not abruptly, but honest with them. That's what we have to do. We are humans in this process. No one is all knowing. There is something there's a being that's all knowing, but we are not all knowing. So we have to be careful in how we communicate and how we present ourselves. So emotional intelligence is huge. And my third point, I'm just going through a few pointers with you. The third point I just want to talk about is improving your health outcome. So when you have an opportunity to effectively communicate and you build that relationship with your healthcare provider, you tend to have a really good outcome. And you have a greater chance of a better outcome. And it allows you to be proactive in the care that you're going to receive and the care that you're going to provide to yourself, all right, for yourself. because your intention is to stay informed about your condition. Your intention is to identify treatment options. Your intention is to have a greater satisfaction for your own personal care. That is the intent of it. And then the other item I would like to say is that when you do get that plan from your physician, be sure to follow the plan. If the plan doesn't work, meaning like whatever you're coming in for, and they give you some suggestions and you do not adhere to them, and you come back and say it didn't work, be honest with yourself. If it's not working or you find that there's something that you're uncomfortable with, that's when you call back and ask the schedule to speak to the nurse, and then you can make some adjustments. Adjustments can happen. That's the purpose. Like I said, we're all humans. Doctors are humans, specialists are humans. So it's about how we manage our process of speaking to them. And if what they have laid out for you as your wellness plan and you don't feel comfortable with it, you need to speak up because you're the one who is there to receive that particular treatment or that particular care. So, like I said, I had a couple of things that I wanted to discuss in regards to it to you about emotional intelligence and how it talks about how it's like pretty much reading the body language of one another and knowing how one person feels, but also being an effective person of understanding their emotions and understanding your emotions, where you're managing your stress. Because oftentimes when you go in the doctor's office, you feel a little stressed, and how you manage those emotions while you're there. So keep that in mind while you're doing that. So you develop a form of empathy in that process. So I'm just going to go over everything that I discussed. First, understanding that emotional intelligence is the ability to recognize and understand and manage your own emotions as well as to the others who are around you. And emotional intelligence matters as a patient to you because it helps you to effectively communicate with your healthcare providers and allows them to understand your healthcare needs. All right. And it allows you to show that you're being an advocate for your own medical and your own health. And that's what you want. And it can lead to a better experience, a better outcome. And as I stated, there are times where the relationship or the chemistry may not mesh, but we're talking about when it does mesh, when you are able to really communicate. This is when emotional intelligence on both halves can be beneficial to both people, the provider as well as the patient. Building a better relationship with your provider using emotional intelligence helps you to clearly communicate the needs that you have. You develop empathy in the process, and remember that your provider is human and you are too, and that we all have challenges. But and there, yes, we know there's an appropriate place for those challenges because it is a form of professionalism. But you can still lead off and say, thank you so much for your time. And you can also say, hey, I don't feel like I'm being heard. You can let them know. And then a form of managing our stress and emotions in general is one of the big techniques that you can do. Don't forget that when you write down what you're walking into the doctor's office for, and you have a plan that you have these questions or you want to talk about something, then you can write it down. And then that presents to them that you are on the money and you're ready to learn how you can feel better as well. And then the last thing is when you do those two things, those two key things, such as understanding emotional intelligence and understanding how to build that relationship, then you present yourself of having a better health outcome. And that's what you want. Now, I know that there can be challenges. I'm going to repeat that over and over and over again. And it's okay. But it gives you an opportunity to consider the best next steps. So I'm just going to leave you by saying start by practicing self-awareness for yourself, understanding what empathy is and how it relates to your emotions. Be sure to use those opportunities to have effective communication. I want you to take small steps in this process. Understanding and regulating your own emotions takes time. Understanding how to communicate effectively takes time, and building those relationships takes time. But once you are able to manage these experiences and gather some of these tips, that will allow you to have an effective healthcare opportunity for yourself and have a better outcome. I want to say thank you so much for just joining me on this live podcast. I'm gonna try it again next week. I'm gonna try it again next Thursday. I just need to pick a good time to come on. Maybe 8 o'clock is not a good time, but we'll find out. Go ahead and leave on here, followers. If you go ahead and just tell me what time on Thursday works for you, let me see if it works for me, and I'm gonna try my best to have it. I'm gonna try it again next week. Once again, my name is Dr. Jewel White Williams. I have a doctorate in health sciences. And I just want to say my intention is to focus on healthcare, community health, rural communities, helping our churches with their health and wellness plans. I want to see a holistic community focusing on their health and bridging those gaps. Thanks again. I thank you guys.